So your rotator cuff are four muscles that come off of your shoulder blade. They pass up to form a cuff of tendons over the ball, up the front, over the top, and down the back. It's the most common source of pain in the shoulder, so a lot of different kinds of injuries can occur with it. Generally speaking, the rotator cuff is going to be involved with a lot of overhead reaching and activities that are away from the body because its function is to keep the ball sort of centered in the socket while the bigger muscles do their work. Rotator cuff tears are a pretty broad spectrum of injuries, and there's a big difference if a rotator cuff tear is what we call a full thickness tear, if the tendon is actually detached from the bone, versus what we call a partial thickness tear, which are far more common and really kind of treated differently for the most part. The rotator cuff that's partially torn or just inflamed or irritated, there's a lot of other things that go along with that. You'll hear about bursitis in the shoulder. Impingement is a word that gets used to describe the process that causes that tearing. It's a pretty large category of injuries and shoulder pain. And almost always those can be treated non-surgically. They respond well to physical therapy and anti-inflammatories, and that treatment algorithm can lead into surgery at some point, but a majority of the time those rotator cuff tears are not really treated the same way as you would if you had what we call a full thickness tear. If you get a full thickness rotator cuff tear, those are usually surgical issues. Depending on your age and the chronicity of it, there's an even bigger, a little more complicated issue with those rotator cuff tears, where if they are massive tears or if they've been there for a long time, if they're chronic tears, those can actually not be fixable. And so there's a long conversation that you have about the options, but if you're young and healthy and you've got a full thickness rotator cuff tear, that is usually going to require repair.